What if I told you that faith and health are two sides of the same coin, and when they don't work together, the results can be tragic? Welcome back. Today, I'd like to share a powerful story about faith, health, and a woman whose life ended too soon. Some time ago, I met a woman in her early 50s who came to me for a breast scan. Her case changed the way I think about the balance between faith and medicine, and I believe her story holds lessons for all of us. When she exposed her breast for the scan, it was immediately clear to me that something was wrong. The signs of breast cancer were unmistakable. As I proceeded with the scan, my worst fears were confirmed. The cancer had not only affected her breast, but it had also spread to her armpits, indicating an advanced stage of the disease. We also did a chest X-ray, which confirmed that the cancer had already spread to both of her lungs. Now, I have seen many cases of breast cancer at this late stage, primarily because many patients are referred to me for cardiac evaluation. We often assess their heart with echocardiography to establish a baseline, as certain cancer drugs can have side effects on the heart. These medications can potentially lead to heart problems, so we take every precaution to avoid creating a new issue while trying to solve the original one. What struck me most about this woman was that she did not fit the typical profile of patients who present with such advanced breast cancer based on my experience. Most patients I see at this stage either lack health literacy or face financial constraints, leading them to resort to traditional medicines or delay seeking help until the condition worsens. However, this particular patient did not fall into that category. She spoke well, appeared educated, and didn't seem to be financially disadvantaged. Naturally, I was curious, and that made me to ask her about the history of her condition. She shared her experience with me, saying that 3 years ago she had noticed blood coming from her nipple, a major red flag for breast cancer. When I asked her what she did about this symptom, her answer shocked me. "I prayed about it," she said. Her faith was unshakable, and she believed prayer alone could bring healing. Eventually, the discharge actually stopped, so she assumed the issue was resolved. However, months later, when the discharge returned, she turned again to prayer, hoping for the same outcome as the first time. This cycle continued until her sister finally brought her to the hospital. As a medical doctor, I have the utmost respect for my patients' religious beliefs. Faith is a powerful part of healing, but my training in evidence-based medicine has taught me that faith and medicine should work together. Faith is not meant to replace medical intervention, but to complement it. This woman's story was one of the most striking examples of what can happen when the two aren't properly balanced. Whenever I encounter religious patients like this, I often share the story of the 10 lepers from the Bible, a story that resonates across different faiths. In this story, 10 men with leprosy called out to Jesus Christ, asking for mercy and healing. Jesus responded by instructing them to go and show themselves to the priest. Now, at that time, the priest acted like a physician, responsible for examining and declaring someone clean before they could rejoin society. Jesus, the ultimate healer, did not bypass this process. His instruction emphasized that Medical confirmation is an integral part of divine healing. This is a crucial principle. Faith can initiate healing, but medical confirmation is necessary to verify and ensure lasting health. Unfortunately, this is where the woman's story went off track. After praying and seeing temporary improvement, she assumed all was well and did not consult a doctor. But faith does not mean ignoring the role of physicians, just as Jesus did not ignore the role of the priest. Now, her experience serves as a reminder. Please pray, believe, and seek healing. But never forget the importance of consulting a doctor. While prayer is a powerful tool and faith can provide great comfort, it is essential to use all available resources, including modern medicine, to address health issues. Ignoring medical advice can lead to severe consequences. After my consultation with her, I prepared my reports and referred her to another doctor for further management. Unfortunately, despite the doctor's best efforts, she passed away just a few weeks later. Now, reflecting on her case, I realized how crucial it is for healthcare providers like myself to understand and respect their patients' beliefs while guiding them toward medical decisions. Balancing religious beliefs with medical care is actually delicate, but it is essential for effective health care. I also want to emphasize the importance of early detection and regular medical checkups. Breast cancer, when caught early, can often be treated successfully. Regular mammograms and breast exams are vital for early detection. Please, if you notice any unusual changes in your body, don't hesitate to seek medical advice, even if the symptoms seem to resolve on their own. This story also underscores the importance of health education. Many people may not recognize the significance of certain symptoms or even know when to seek medical help. For example, her case of bloody nipple discharge was a huge red flag. While this could indicate a benign breast condition which we call intraductal papilloma, it can also be an early sign of breast cancer, like in her case. As a healthcare provider, I strive to respect and integrate my patients' beliefs into their care plans. A patient's mental and emotional well-being plays a crucial role in their overall health. Supporting their spiritual needs while providing the best medical care can lead to better health outcomes. For instance, if a patient believes in the healing power of prayer, I encourage them to continue those practices as long as they don't interfere with necessary medical treatments. This collaborative approach respects both medical science and spiritual beliefs, providing holistic care and improving patient satisfaction. Let this story be a reminder: faith and medicine are not enemies. They are partners. No religion wants you to neglect your health. Pray, believe, but also act. Regular checkups, early detection, and medical intervention can save lives. Take care of your body. It is the temple where your faith resides. Your health is a precious gift, and taking care of it is one of the best ways to honor that gift. Don't hesitate to reach out to healthcare professionals for guidance and support. Small actions like regular medical checkups can make the difference between life and death. If this story resonated with you, please like and share it with friends, and also leave a comment below. Your engagement helps spread awareness and education. Together, we can save lives. And also, don't forget to subscribe and follow for more health stories, highlights, and advice that could help you or someone you love. Thank you for watching, and I hope this story enlightened you about the importance of balancing faith and medical care. Stay connected for more content, and until next time, stay healthy and take care of yourselves.